Hey, it's Anastasia's Hump Day Happenings. This week, I'd like us to focus on patient-centered versus being self-centered. Can you imagine the results that you would have as a small business or even a healthcare professional? Let's take two stories, for example. This week, medical profession. They determined that the HPV vaccine given to adolescents between the ages of 12, 16, and 17, male and female, they decided, hey, 2 injections may work instead of 3. May work. Well, who decides this? And how many of these people had 3 injections, and how do we know the long-term side effects? Now, what was the HPV vaccine for? The strain 1618, which is associated with cervical cancer. Well, what's that have to do with the male gender? That would be the question. Now, if you're patient-centered, you would offer your patients alternatives, such as non-invasive screenings, to see if you have the HPV strain. Why? Well, let's get educated. What else is HPV associated? In fact, that particular strain. It's associated with sexually transmitted diseases and a very high risk factor for oral cancer. There are non-invasive versus our spit. So ask your dental professional about this. If you're patient-centered, then you're not just going to make this a one-size-fits-all. Hope that answers your question about that. The second one is a dental profession. Now, I'm involved with a beta testing with an anesthetic delivery system. What I find interesting is it's not about the technique of the anesthetic delivery. This is about patient comfort, and it's about choices. So I found interesting this week, I go in after I trained a dentist, and I find the injection system literally sitting on his countertop. He didn't want to use it. He said his injection technique was fine. I don't question that, but here's what I do question. What if you as a patient had an option? What if you had an option between the traditional injection, which can be painful sometimes, and then what if you had an option to have an injection delivery system that only had one tooth, no collateral anesthesia, meaning your lip is not numb, and it was comfortable? Would that change your mind? I think it would. You know what I find interesting in closing? Is the fact that we as healthcare professionals complain, we blog, we write, we talk on forums about how the government is slacking with healthcare. They're making choices for us. It's ironic, is we as healthcare professionals, small business owners in dentistry and medical profession are doing the same thing. We are not even giving our patients choices. Until next Wednesday, take what you learn, make a difference with it.